Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is senior researcher Sarah Seibert. Hi, Sarah.
Hi, Alex.
So you had the opportunity to speak with Neil Evans, Chief Officer of the Office of Connected Care at VHA, and I believe he is also the Senior Advisor to the CIO OIT at VA. That's a lot of title.
It is, yes. He is VIP at VA.
VA VIP. So we saw a massive growth in telehealth at the beginning of the pandemic. How is VA approaching telehealth now that providers are offering in-person care again?
Yeah, so telehealth actually existed long before COVID started, but it grew tremendously, as we've seen, out of necessity. So when providers were limiting in-person care because of the pandemic, it was essential that patients could still meet with providers. So now, even though in-person care is being offered again, telehealth isn't going anywhere. The focus is on improving delivery of telehealth services and ensuring it's equitable. So Evans will discuss how VA is focusing on security, data management, closing the digital divide, and more to make healthcare an option for everyone, which can actually improve ease of use and efficiency of healthcare moving forward, even though in-person care is being offered again.
Going back a couple of seconds, you mentioned the digital divide. For our listeners who don't know, what is that?
Yeah, so digital divide is a term that refers to the gap between demographics and regions that have access to modern technology and those that don't or have restricted access. So this technology could include personal devices like smartphones or internet connectivity, for example. So while telehealth offers providers and patients a more accessible care platform, it's important to ensure that it's accessible for everyone. So Evans will discuss how VA plans to do this in our conversation.
Yeah, it is important to think about that digital divide. I know teleworking, I'm on the computer all day and I think of internet and connectivity as being just a given, but I don't know, imagine being in the middle of Wyoming or just somewhere that's a little distant. Yeah, it's good to be reminded of that perspective. So, what will the future of this hybrid healthcare model look like?
So, to simplify it, I think the future of the hybrid healthcare model is using technologies to connect veterans, in this case, since we're talking about VA, to healthcare, whether they're inside a VA medical facility or at home. So, moving forward, I think we'll see a lot more initiatives around building trust with patients and providers as they integrate more technology to improve the time and quality of care. I think we'll also see a push to improve information access so veterans can reliably access their VA healthcare records and other key information online.
Well, with all of that in mind, let's take a listen to your interview.
Thank you so much for coming on the show.
Thanks, Sarah. It's great to be here.
Yeah, so last time we spoke was almost a year ago at HIMSS 2022. You discussed some of your initiatives then, and I wanted to touch base on any progress you've made over the years. So specifically geared towards remote home monitoring, video-based care, telecritical care programs, and other initiatives. What are some of the mile markers you've made over 2022?
Yeah, well, and I'm glad that you actually mentioned all of those different types of telehealth, or, when we think about connected care, telehealth, it's really about using technology to enhance our ability to care for the veterans in the VA healthcare system that we're called to serve, and to care for them in the most convenient and optimal way, including in their home, optimizing care in our clinics, and even optimizing care in our acute care hospitals. So you mentioned remote home monitoring. You mentioned video-based care, which we can do at home, but also we do video-based care with examination capabilities in our clinics. And you mentioned telecritical care, our ability to provide 24/7, 365-day synchronous telemedicine support for the sickest of veterans that we're caring for in our intensive care units across the organization, which I guess highlights, I know the question that we're going to get to is about progress over the last year, but it highlights to me how important telehealth is ultimately for healthcare systems in meeting the needs in this modern era of the patients they serve really across the spectrum of care delivery. Summarizing some progress from the last year in our fiscal year 2022. So from October 21 through through the beginning of October of 2022, more than 2.3 million veterans received over 11 million episodes of telehealth care. Wow. And of those 2.3 million veterans and the 11 million episodes of care, over 9.2 million of the 11 million episodes were video telehealth care into the home. So I think if and we'll get into this maybe a little bit later, if we sort of look at before the pandemic and now, that's a real significant change where we're delivering care into the home. Mm-hmm. Many of those other video visits were care in our clinics where we're able to connect veterans, sometimes in one of our more remote rural clinics, with the highly trained subspecialists who can best meet their needs, who may not actually, may not be that specialty of care may not be available in the local community, but we can use telehealth to bring it to the veteran where they are. 130,000 veterans enrolled last year in our remote patient monitoring program, tracking their vitals and other health data from home with support from care managers in VA to help them navigate their health, often very complicated health issues in their home environment. And then with regard to telecritical care, we continue to expand our footprint of telecritical care. We are monitoring 24 hours a day, 7 days a week, 365 days with board certified intensive care physicians and highly experienced intensive care nurses, more than 1,000 ICU beds across 73 of our facilities. So again, and that's actually 34 more facilities since we began an expansion in 2021. We plan to add another 400 ICU beds under telehealth monitoring from now through the end of calendar year 2023.
That's really impressive. And I know you alluded to this in your answer, and we've talked about it on the show before, but VA was uniquely positioned before COVID in terms of telehealth, where you all had capabilities to really ramp up as demand increased. Like, one thing that sticks out to me is the two-way black and white television. I will never forget that. But with the massive expansion of telehealth following COVID, how has VA maintained telehealth quality while keeping pace with demand?
Yeah. Well, you mentioned that two-way black and white television. I guess we probably have to provide context now for the listener here. The first telehealth visit in the VA was in the 1960s and was by two-way black and white television, right? So which is, and I think I've shared with you a picture of one of those visits, which is very memorable. And when you look at that picture and think about how far we have come with, frankly, how easy it has become for us to connect with each other by video, and, video, audio, essentially technology has become a lot easier to use. And I don't think that's unique to just healthcare, right? It's across all industries. Telehealth, I mean, the addition of audio, video, high definition, secure audio video connections is transforming how we do business in many industries, but certainly in healthcare. To your point, VA had been investing in connected care for many, many years leading up to the pandemic. And that served as an incredibly strong foundation for us as we faced the unprecedented demand that the and shift to virtual care in the home that the pandemic presented. Just to give you, again, a little bit of a sense of the scale, I think it's helpful.
Mhm.
If we go back over the course of the pandemic, the last 3 fiscal years, VA has provided veterans with over 27.9 million telehealth episodes of care. And those are, so this is different than the numbers I provided a few minutes ago, but this is specific to the time course of the pandemic itself. That's 22.7 million video visits to the home. That's a 3,000% growth rate since before the pandemic. So I always find that a little bit like worth sort of pausing a little bit and thinking about it. We were doing a lot of telehealth into the home before the pandemic. And yet, even with what we thought was a reasonably high baseline, we had a 3,000% increase and have completed over 22 million visits to the home since the pandemic. And to your point on the question, a lot of that had to do with that foundation that we had built. We had to adapt with regard to our IT infrastructure to have it scale, but we had the teams in place to help us navigate those waters. We had to train new clinicians, but we again had the training materials, and we already had a significant number, more than 80% of primary care providers and mental health providers had already participated in video visits prior to the beginning of the pandemic, or learned how to use the software to do so. And we had a quality management program in place as well to make sure that we were delivering high quality care. And I think that's part of why we're still seeing a sustained demand for care via telehealth and very high levels of satisfaction from veterans. More than 85% of veterans reported that they trust VA telehealth as part of their care, which in my mind is a very good news story.
Yes, I agree. Those stats are incredible, especially with how fast you pivoted and the growth reported and the satisfaction. So kudos to you and your team. So what tools or services is VA leveraging to secure veterans' health data and stay up to date with current IT security standards?
Yeah, that's a great question. As we move care, as care occurs through technology, and it's not just care that's delivered, it's not just telehealth care, right? It's information. Healthcare, in many ways, is about the relationship that we as patients can have with our healthcare teams and providers. It's also about the healthcare information, whether that be our lab results, our imaging results, the opinions of the clinicians that are taking care of us as patients, right? That information is really critical to healthcare, right? And it's part of the information that subsequent providers that we see as patients need access to. And frankly, that when we as patients are engaged with our own healthcare, understanding our own health data is part of the journey of living a healthier life, and understanding one's health to be able to manage that in your daily life. And we believe very strongly in the VA that it's important to get veterans their health data in their hands, and also to provide them the opportunity to connect with their healthcare teams in convenient ways to support their healthcare. But to do that requires technology, and it requires an attention to security and to assuring the privacy of that information. So that's absolutely critical. We our va.gov is our digital front door for veterans. We want veterans to connect with us in va.gov, and My Healthy Vet is the patient portal that is part of that overall experience. We spend a lot of time thinking about how to appropriately secure that information, but also how to make sure that we're making it as convenient as possible for veterans themselves to access their own information. That is, we want to make sure that login is that we're putting secure, we're making login secure, but also login sufficiently convenient for the individual who should be seeing their healthcare data. And one of the things that I'm very excited about is we've recently launched a mobile app, VA Health and Benefits app is the way to find it on the Android App Store or the Apple App Store, that now leverages our secure, we can use our secure login credentials to log in. But once you've logged in using the multi-factor authentication, you're able to then persist that login and use biometric connections like fingerprint or face identification to persist one's login over 90 days. So that's really improving the convenience of accessing information for veterans while simultaneously being holding to the high standards from an information security standpoint. For telehealth, our video visits are all encrypted end to end. One of the things I actually love from when we talk about IT security and talk about privacy with telehealth is when we're doing video telehealth, it's actually, from a privacy standpoint, it's actually easier for me as a physician, as a provider, to have a good sense for the security or for the privacy of the visit when we have a two-way video going on. So in other words, on the telephone, I have to identify and make sure that I'm talking to the right person and ask for some identifying information to make sure that I'm talking to the right person. I don't know who else is in the room with that veteran when I'm speaking to them. But with video, particularly for the patients I've been seeing for many years, we have an encrypted end-to-end connection, and I'm actually able to verify, because right there in front of me is the patient that I expect to be there, and I can also tell whether they are in a place where they feel comfortable talking about their health care and that they have the privacy that they need. So I actually think that's an interesting question about security and privacy, because sometimes we don't think about how sometimes new technologies can actually maybe even enhance the security just simply by, for example, adding video.
Right. That's a great perspective and an interesting take. So while telehealth is increasing access to care, there are still challenges when it comes to the digital divide. How are you working to bridge tech gaps for veterans that live in rural areas or may not have access to smart devices?
Yeah, Sarah, that's a great question. And I think this ultimately gets to the question of equity. The digital divide is an issue of healthcare equity. Are we providing the same opportunities for all veterans to connect to care? And, there are challenges that exist, particularly in rural America, but frankly, challenges with access, whether it's access to the right type of technology, as you mentioned, having access to a smart device, access to sufficient broadband internet, and that whether that's being able to afford sufficient broadband internet or even having access to sufficient broadband internet in one's community. These are really important issues, and we often, I think, wrap these up and describe them as the digital divide. And we in VA have spent a lot of time thinking about that. I think I'll highlight 3 initiatives. The first is something that we call the Digital Divide Consult. And this is something I'm particularly proud of that VA has done. I'm sitting here doing this interview today with you from my clinic examination room, where I was actually seeing patients from my primary care panel this morning. And if one of my patients came in and saw me and had a particularly challenging cardiology related issue that I needed help from a subspecialist or somebody else to help me resolve, within the electronic health record, I could enter a cardiology consultation, or sometimes those are referred as referrals, but I could ask for help, and the electronic health record would then deliver that to the right office, where somebody would reach out to the patient and get them scheduled for an evaluation, and then I, as the primary care provider, would get the report back about how things had gone, and we would deliver the services to veterans in that way. So it's that. So the idea of being able to put a consult or referral in is really part of how healthcare systems operate, and is the way providers think. And we've been able to introduce across the entire VA a consult that is the digital divide consult. So just like I can order or ask for assistance from cardiology or rheumatology or general surgery, I can also put in a request for help from the digital divide consult team. And I can do this for a patient who is struggling to get connected with us for whatever reason, access to technology, access to sufficient broadband internet, as an example. And they are then able to meet with a VA social worker who can help that veteran determine if they might be eligible for certain programs that offer free or discounted internet services. For example, the FCC's Affordable Connectivity Program, the FCC's Lifeline program, or some local program in the community. And in addition, they're able to assess whether the veteran might benefit from a device that we provide to them, which I'll talk about as kind of the second initiative. Digital divide consults in fiscal year 22, we completed over 41,000 digital divide consults, which I think really shows a commitment to say this is something that matters and is important as other parts of healthcare, is that connection or access. One piece of what the digital divide consult can help get veterans connected to is the VA Connected Devices program, or where we loan tablets, internet connected tablets, to patients to allow them to connect when they don't have access to the device or the internet that they need. We've loaned more than 110,000 veterans a tablet in fiscal year 22. The veteran's able to use that tablet while they need to be connecting for healthcare, and then can return it to the VA, where we're able to then reuse that tablet for another veteran who needs to connect. And we've seen some great results as we've researched and looked at the outcome of this. We did a study that was published in April of 2022 that looked at over 470,000 veterans living in rural areas. And we found that those who received a VA tablet were more likely to complete the full course of mental health care treatment via video that was recommended based on evidence, that there was actually increased attendance and visits across all modalities, both in-person and video care, and reduced suicidal thinking, behavior, and emergency department visits. So real outcomes by providing that connectivity. And then the third area I'll talk about with regard to equity and digital divide are partnerships that we have with AT&T, SafeLink by TracFone, T-Mobile, and Verizon that allow veterans to connect by video to us on their mobile devices without paying data charges. So if there is for those who have a plan where there may be an additional cost for the amount of data usage, connecting by VA Video Connect through one of our telehealth visits doesn't count against that. Again, increasing the affordability for veterans of their ability to connect to healthcare.
We're going to take a break from today's interview and play a game I call Archive Deep Dive, where I challenge our hosts to identify a previous guest on our podcast. Playing today are senior researcher Sarah Seibert and staff writer researcher Catherine McPhail. Hi, everyone.
Hi, Alex.
Hi, Alex.
Here are the rules. I will play the clip, and if you know the answer, buzz in using a buzzword. Today's buzzword is transformation. If you get it wrong, the other player gets a chance to guess, If neither of you get the answer, I open the floor to random guessing until somebody gets it right, or I give up and tell you. There are 3 clips today. Are you ready?
Yes.
Maybe.
Did I sound more excited that time?
See, before we started this one, Sarah, you said that you wanted to get into a fight. You want us to be angry and mad.
Catherine suggested a brawl.
Oh, Catherine
So
suggested a
I
brawl.
countered with a verbal argument.
Well, tensions run high playing Archive Deep Dive, so let's hope that it doesn't turn to fisticuffs.
I'm here to win, not to have fun.
Well, with Archive Deep Dive, no one ever has fun. So let's go with clip number 1.
I'm sure for those of you that are out there listening to these health casts, you've probably come to know that NIH is comprised of 27 institutes and centers, and one of those is CIT. And while most NIH institutes and centers have a specific research agenda, such as conducting or supporting research on cancer or aging, the role CIT plays in the enterprise is a little bit different.
Transformation?
Yes.
Is it Jyothi Dugar?
No.
Is she from CIT?
This person is from CIT.
Right.
Yes.
I don't know, Jyothi. I don't know. You're NIH girly.
Well, actually, Nikki is NIH. So this is probably Nikki's episode. Innovation.
Yes.
I know Nikki did an episode with Susan Gregaric.
That is incorrect.
Oh, man.
It is somebody from NIH's Center for IT. My other hint is that this is before Nikki's time. This is from season 2.
So Melissa?
Oh.
Question mark, maybe.
Time is this episode from?
Don't look at my laptop.
Catherine's
I'll look
gonna
it
give
up.
it a goog. The verbal harassment or argument is about to begin.
Okay, so
I actually didn't see. I have no idea what it is.
Stop. Okay. December of 2021. Nikki was with us for this.
I
Nikki
barely
was
even
here
worked
for, like,
Okay, I'd been here for a month.
a
so I
couple
guess
months, yeah.
maybe I should know what this is. If it was gonna be before my time, I was like, Alex, how do you expect me to know this?
I still think it was Melissa that did the interview.
Oh, I do think it was Melissa that did this
But-
interview. But no, I don't know who it is. Alex?
Melissa can't help you now. It is Stacy Album, Deputy Director, NIH Center for IT.
Oh my
Okay.
god, of course it's Stacy. Wow. Sorry, Stacy.
Embarrassing.
All right, on to our next clip.
Well, our big initiative right now is that we are planning on behalf of the VA the Brain Summit, which is intended to be essentially a small academic conference or technical conference thrown by the VA. That this will be a 3-day meeting in September in the Washington, D.C. area from September 7th through 9th. And the intention is that we will explore how artificial intelligence is applied in various different domains that we sort of call total brain health.
Transformation.
Yes,
Is it Raphael Frick?
it is Raphael Friggs, Associate Director for AI in Medical Imaging at the VA. Now, bonus question, which appearance is this? Is this the live appearance or is this the studio, quote unquote studio?
Wow. Fun fact. I've never interviewed him before.
Oh.
I just knew it wasn't Gil. But I would guess that it is not the live recording unless we got mic upgrades since then.
No, no, that was just a traditional HealthCast interview with Raphael Fricks. Excellent job. All right, the last one. Catherine, you could come in to tie this all up.
Oh gosh, the pressure is mounting.
She won't though.
Whoa.
Sorry. You can cut that. I was just trying to Josh because of our verbal argument. But no, I feel
I
bad.
thought it was funny.
the sparring.
You better watch out, Sarah. I'm coming for you.
Well, don't trip over yourselves to answer this one first because you definitely know this person.
Well, the National Artificial Intelligence.
Transformation.
Oh.
Gil Alterovitz.
Oh my
Director
goodness.
of National Artificial Intelligence Institute. I guess the bonus question on top of this is Gil has been on this podcast like 3 times. Which appearance is this?
This is the second most recent, not the super most recent on the AI.
most recent?
The super most recent was on the AI Bill of Rights. The second most recent was the AI National AI Network.
That's correct. Well done. All right. It got a little heated. Do you all think you can still be friends after this?
I have it in my heart to still be your friend, Sarah.
You too.
Okay. This is good.
Healthcast and Archive deep dive at once, tearing us apart, but also bringing us together. What a great way to wrap up this game. Thank you both for playing, and now back to the episode.
Thanks, Alex.
Thanks, Alex.
So, VA has made a lot of progress with telehealth since the onset of COVID-19. What are some areas that you could still continue to grow or progress, and how do you envision the future of telehealth?
Yeah. So, I think I think in many ways, telehealth has been something, has been an important part of the healthcare journey for, frankly, all healthcare systems in America. But certainly the pandemic and the requirement, sort of the sudden reliance on telehealth for care has opened the eyes of really many of us as Americans to the value that telehealth can bring in enhancing a more traditional model of healthcare delivery. I don't think it will never replace traditional in-person care because there are some things that have to be done in person. But thinking creatively about how we can increasingly have that sort of just right blend of virtual care and traditional in-person care that optimizes outcomes for patients, but also improves the experience, the efficiency, and the convenience of healthcare. Frankly, also increasing the ability for us to connect maybe more frequently for shorter interventions than traditional in-person care allows. And so I think there is just a lot of opportunity still to think about that blend. What should that look like? And what are some of the new technologies that can enhance that blend between in-home virtual care and then traditional in-person care? And so, an example of that might be how we think about integrating more patient-generated health data into care delivery. So health data, whether that be from a wearable device, whether that be self-entered by a veteran based on prompting from, let's say, a text message or a mobile app or something of that sort, collecting that patient-generated health data in more of a continuous fashion, and then helping that inform healthcare and recommendations between a provider and patient is an area where we see an awful lot of opportunity for growth, and are doing a lot of work in preparation for that. We, over the last year, have really been scaling out the use, for example, of a new application called My VA Images is a great example where if there's a need for, this is really an asynchronous form of telehealth, where I can prescribe and ask for one of my veteran patients to send me a short form video of how, of their gait walking in the home, or let's say a tremor, or a rash that they have from a dermatologic perspective, or something where an image collected maybe even regularly over time would help make better clinical decisions, either at the next video visit, at the next clinic visit, or actually even in real time. And so starting to think about how things like patient-generated health data, asynchronous image exchange can improve healthcare overall, to me, is an area where there's a significant opportunity for growth.
Right. That's really exciting. And maybe we can touch base in the future on how those continue to evolve.
Absolutely.
So, as more people are using the internet to access their healthcare and information, how is the VA ensuring that veterans can reliably access their health records or other key information online?
Yeah, this is super important. And I guess I'd start out by saying that we've had a long-standing commitment to veterans that we want them to have the ability to connect to their health information online and to connect with us online. Since launching My Healthy Vet, our online patient portal, in 2003, over 6 million users have used My Healthy Vet to access their VA healthcare online, filling more than 219 million prescriptions, sending over 163 million secure email messages to their healthcare teams, downloading their records to review their health information more than 54 million times. So there has been, again, a long-standing commitment to making sure that health information is available to veterans, but also that we're delivering, that we're increasingly thinking about how to deliver the ability to transact and communicate with us in the VA online. And I guess one of the exciting, I mentioned it earlier, is our flagship mobile app, the VA Health and Benefits app, is something that we've released and are continuing to grow over the last year plus. As of this past December, we've seen over 1.1 million app downloads and are seeing more than 500,000 active users on an average month. And interestingly, seeing a lot of interest for veterans, not surprisingly, to say, it's important for me to be able to access my information online. It's just as important for me to access my information in a convenient way on a modern mobile device. And so I think, in answer to your question, as more people are using the internet to access their healthcare and information, we're going to continue to deliver great web experiences. But most people are also, many people, in fact, probably the majority of people, are accessing the internet more often these days from a mobile device. And so we're committed as well to continuing to improve and enhance what we deliver through mobile applications. And again, the flagship mobile app is a great example of that, the VA Health and Benefits app.
Yeah, it's funny you mentioned that. Just yesterday afternoon, I had an interview on the Health and Benefits app, and it's really incredible how everything is so centralized, and it's a great tool for veterans. So I know you've outlined some of the areas for growth, but over the coming year, what will be some of your top goals or priorities for the Office of Connected Care?
Yeah. Well, one of the top priorities for the Veterans Health Administration is providing the soonest and best care for veterans. That's one of our several priorities, super important one. And it's, I think, the one that Connected Care is best mapped to when we think about what can telehealth, what can mobile health capabilities, like we've been talking about, what can patient portals, what can use of patient-generated health data enhance. It's really about that, making those connections, providing soonest and best care. And we think about that, I like the within the Office of Connected Care, we think of this as it's really thinking about what it means to deliver healthcare without walls, thinking about and continuing to expand the reach that we have, connecting with veterans in their home. And we've talked about video care. We've talked about mobile applications. We've talked about our online presence, My Healthy Vet, our patient portal. We've talked about remote home monitoring, continuing to expand patient-generated health data, that footprint in the home. But also, when we talk about delivering healthcare without walls, it's also about leveraging the incredible resources that we have within the Department of Veterans Affairs, with really remarkable healthcare expertise across our health system, and making sure that we are getting that we're using technology to connect veterans, even when they're in our facilities, with providers who can help meet their needs. So it's I would say, just to sum up, our top goals are to keep pushing ahead with driving our vision of using technology to deliver trusted care that is available anytime and anywhere for veterans, to help them connect to the soonest and best care for them.
Yeah, that's a great closing quote. And I appreciate how in-depth you went with all of these questions. It's really exciting to see how you're continuing to close that digital divide and provide some of these more modern health solutions to all veterans. So thank you for joining me today.
Thanks, Sarah. This has been fun.
That was a great conversation, Sarah. Before we let our listeners go, are there any last thoughts or highlights that you want to leave them with?
Yeah, I think telehealth came around because of the immediate need for it, but now providers and patients are seeing the benefits, whether there is a pandemic or not. So it's not just going to go away as COVID hopefully goes away. And this will be something that they'll continually build out and improve to make sure that patients everywhere are able to access their providers and their personal information in the best way they can.
Definitely. I know that there were so many changes just on a fundamental level that happened almost 3 years ago at this point, and a lot of them have been initiatives that I think were long overdue, and I hope we can just keep this momentum going and continue to provide the best healthcare possible.
That's right. Me too. Before 3 years ago, I was working in an office, going to doctor's appointments in person, and now I'm sitting here with you on a virtual meeting and have telehealth appointments. I love it.
We really are living in the future. Well, thank you so much, Sarah. That wraps up today's HealthCast, but have no fear, we'll be back next week with a brand new episode. Until then, please subscribe to HealthCast and leave a review on the podcast platform of your choice. I'm Alexander Bulova.
I'm Sarah Seibert.
Thank you for listening. HealthCast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them on your favorite podcast platform. And if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@govcio.com.